Hi, I'm Bob Buckhorn, and welcome back to another Mayor's Hour. We get to highlight, along with my partner Jack Harris, some of the great things that are happening in this community and highlight some of the great people that make them happen. We are here today, Jack, at Tampa General Hospital, which, as we all know, is one of this community's best healthcare facilities.
Oh yeah, over the past couple of decades, this place has emerged as just a giant in healthcare, in the healthcare industry, and of course for Tampa Bay.
Yeah. And we are so lucky to have the healthcare professionals here at Tampa General Hospital. It's obviously a teaching hospital as well for the University of South Florida. I mean, we are so fortunate and to have this critical care facility here. They are doing world-class medical research and world-class care, and so, you know, just to be at Tampa General Hospital and to see how far Tampa General Hospital has come over the last 15 years under the leadership of Ron Hightoff really has been amazing.
Yeah, that's been the big thing, because at one time, I remember them bringing in people and doing everything they could to shore up the red ink to get it out of trouble, really. And then Ron came in, and it's been a whole different story since then, and it's just risen to the top of its field.
Well, one of the other things that I really enjoy doing is getting the opportunity to highlight some folks that really make a difference every day in the lives of this community. We are so fortunate, Jack, and certainly as mayor, I appreciate more than anyone can imagine some of the folks in our community who just get up every day and give back to our city. They understand they don't do it for the accolades.
Right.
You know, they don't do it for the newspaper headlines. They don't even want to be thanked. But they are a special breed, and they are what makes this city so different. And, you know, I am just so grateful every day to get an opportunity to walk amongst them and to be a part of it, and to every now and then say thank you to people who give back so much to the city.
And you've got two of them right here with us today.
We sure do. We sure do. They are very embarrassed right now because I know them well enough to know that what they do for us is not because they want accolades and they don't want thanks. Pam and Les Muma are here with us today because of their generosity. This neonatal intensive care facility is now here. It's established at Tampa General Hospital. It is saving lives every day. And Pam and Les, this wouldn't have happened without your generosity. And you know, I can't tell you, on behalf of all of those babies and those families that are being touched by your generosity and by what you did for this community, you're making a difference. And you know, all of us know, certainly I do as the parent of two young children, that we've got an obligation to leave the city in better shape than it was given to us.
That's true.
That's what we do as parents. Those of us who have been blessed to be successful, as the Mumas have, they understand it very clearly. First of all, thank you.
Yeah.
Oh, you're quite welcome.
Yeah.
We do it from the heart, and I think people that are successful have a moral obligation to give back. It's
well, and you two have
life.
lived that creed. I mean, that is your journey, that is your path. You do it every day in more ways than even I know. But this is a big one, Jack.
Oh, it was. I remember when it began, because they talked to me about getting involved, you know, just as an MC or to help out and do things like that, and coming down and seeing the old neonatal unit and the hard work they were doing there, the cave.
That's what I called it.
That was about what it was like. And, you know, to have a world-class hospital like this, and yet the neonatal unit just wasn't really up to snuff at all. And to be able to finally have the facility that we have now, it's just amazing. And again, thanks to you guys. It's just amazing.
Well, thanks to us and a lot of other people. We jump-started it, but a lot of other people piled on with us and gave money to make this thing happen. And it's everything we expected, probably everything and more than we expected when we got this thing started off the ground.
So what was the origin of it? What was it that triggered you to get involved in this in such a significant way?
Well, you know, as you probably know, we lost a baby in neonatal care here 40-plus years ago, our daughter.
No. Less 30-something years ago.
30-something years ago, excuse me.
Women will get that every time.
They will. They watch those dates. And that's really what started it. When we lost the child here, I spent a lot of time in the old neonatal care, in the cave, with our child. Pam was in another hospital in intensive care. So I experienced it. And when we got past that, and it's always tougher on a mom to get past that than a dad, although dad suffers some, she's always wanted to get engaged and give back. And it's been in the back of her mind, in our minds, all the time. We were in Milwaukee for almost 20 years. That when we came back here, we wanted to take the neonatal care and make it as good as it could be. Now, when our child was here and we lost our child in neonatal care, it was the best in existence at that time. It was, that's why she was moved here. But technology wasn't here to save her. Today she would have been fine. Back then, the technology wasn't here, and Pam can talk to that more than I can. So it was that seed that got us going on it. Now we also give to anything that take care of kids.
Yeah.
So that's a nice tie too. And we're also tied to University of South Florida. And our gift was to TGH USF to improve neonatal care, not only from a physical plant standpoint, but from a teaching standpoint and a research standpoint. And so our gift was wrapped around neonatal care, and we'd like to see it even improve from here. We've got our eye now on pediatrics in general, and pediatrics in this hospital.
Taking care of the kids.
Because it's
Yeah.
taking care of kids, and it ties to neonatal care. So that's kind of our new dream on what we can do, and we're working with both TGH and University of South Florida to do something in that area as well.
That's great. Well, Pam, I know you were very involved. You were very hands-on in the development of this.
I was.
Tell me what that process was like. Tell me what's here. What can a mom facing similar circumstances expect when she comes to the MUMA facility here?
Well, first of all, it's a dream come true. I mean, I've had this passion to really make this a world-class facility for over 20 years. I mean, I saw when Les was here with our daughter Jennifer, I mean, it was a very fine, it was the best of the best in 1973. And as the years went on, you know, it became what we said, you know, it really kind of was a cave. And I wanted to see a facility where you could go in. I had done something similar actually in Milwaukee with a physician up there. And I wanted to be able to walk into a private room. I mean, here, you know, we had row after row after row of infants. And you had nurses and equipment standing around an isolate with parents and grandparents. And I mean, and it was hard for the siblings and for the grandparents and all to come in. It was strictly, I mean, it was a community event. And what I wanted was to see a private room for each infant so that they could come, the baby would come into the room. Because, you know, these children are critical care. They are the sickest of the sick. I mean, you know, when you get into the NICU, I mean, you are the sickest babies in the world. So when they come in here, they have a private room. They have their own, their drugs, you know, their prescriptions are in the room. The milk is there for the mothers, you know, to be able to nurse the babies and to pump and do everything that they need to do. Hands-on nurses, individuals. So, I mean, and of course the nursing care was always the finest in the world, but it's even better now because they're working in a better facility, the nurses and the doctors. So the care has just been uplifted, and it's just phenomenal. And the mothers can sleep in the room with the baby. We had the first day that we moved into this facility.
Huge. That is huge.
I mean, we had this little baby, and it actually came from Polk County, which is kind of ironic. It was the first baby admitted into the new NICU a year ago in November.
And Polk County is where Pam and I
And we're from Polk
Yeah.
County. So, I mean, the baby is in there. He had been in the old NICU just down the hallway for, you know, almost 2 months. His baby brother, or his older brother in Lakeland, had never seen him. So that night, the parents got to spend the night in the room with him, and the little brother got to come and see him. And I mean, that's what it's all about. It's about the family. The family need that time alone. They need that nurturing with the child, because in our case, sometimes, you know, the child doesn't always make it. So you need that special time and that special care. And the NICU provides that. And I mean, it provides so many wonderful things. It's not just the space that's here and the technology that's here, but it's the care of the nurses and the doctors that are, like I said, they're world class, and we want to continue that. And I think right now we're probably one of the largest single bed NICUs in the country. And I know when our neonatologists go out and give talks all over the country, I mean, they want to come here and see this as a model for them to build on.
I remember when you started, you know, we first went from the cave and they said, we want to do this. And you couldn't imagine it would be something like it is today. It's incredible what it's become.
And, you know, having lived in that old neonatal care unit, one of the biggest things that hits me when I walk in here is the old unit was noisy. All the beepers going off for all the babies.
Everywhere.
And you walk
And
in
the
here,
lighting.
and it's quiet. And the baby has a quiet place to be. And the monitors are all just in for the baby, so she doesn't hear or he doesn't hear the other.
And the family can be with them.
And the family's
It
important.
is.
It's wonderful.
And it's exciting. I mean, and not only, you know, people are in a critical situation when they're here.
Yeah.
But the overall feeling here is of peacefulness and hope. And that's what we've tried to project here, as there is hope, and as well as the finest care in the world.
I'll just mention one other thing that was important to us, important to Pam in particular, is this is named after the daughter we lost.
Yes, it is.
So provided a degree of closure for Pam after almost 40 years.
Well, you know, it's interesting.
That name lives on.
The Jennifer Lee Muma facility, neonatal intensive care facility. Out of that tragic circumstance, I would venture to say that thousands of lives will be transformed as a result of it.
It is so true.
So, and it wouldn't have happened not only without your generosity, but without you also being an advocate for the world-class healthcare that takes place here, and being willing to talk to your friends about why they should invest in this as well. And so,
and a lot of our friends did invest.
I know they did.
Guys,
Well,
they got the thing really moving. I'll guarantee you that. I remember very well.
Right. But it wouldn't have happened without you, and so.
Well, it would have happened, but it wouldn't have happened maybe as soon.
It was begging and groveling with a mission and a passion, because we had the passion for it. It was easy to go to our friends and say, this is important.
Well, I think that.
But you're going to interview a lady shortly, and but she really is the impetus behind all this, and that's Pam Sanders. And when the first time I met with her, she said, "Oh, help me with the," and because I called it the cave, and she said, "Yeah, you're right, it is a cave." And gee, that was probably 7 or 8 years ago. So it was a long time coming. It didn't just happen overnight, but we got the funds and we got it going, and Tampa General was behind everything, and we had just had wonderful contractors and builders, and it was a wonderful experience.
It's also one of the best relationships between USF and Tampa General. They've got a great one anyway.
Yes, indeed.
But it really tied them together from a teaching hospital, academic medical center teaching hospital standpoint, because of the research, the docs, the chair, all the specialists that have come in.
It's huge.
Well, we're going to be right back with a segment on Tampa General Hospital, but before I leave, I really want to thank you too.
Well, I would like to also thank Tampa General Hospital and the Tampa General Foundation for all the support and the help that they give everyone in this community.
Well, we're here at the Jennifer Lee Muma Neonatal Intensive Care Unit. The NICU, yes.
The NICU, that's
the NICU, and Pam and Les Muma, without whose generosity this never would have happened. These two folks, I can't say this enough. Without folks like this city would be a far lesser place, and we are forever in your debt. So, thank you. We'll be right back. We just left two extraordinary people, Jack.
Well, you're right about that.
You know, you can't say enough about the Mumas and what they have done, not only in their professional lives, but what they have done in their philanthropic lives. They always give back when they're asked, and they never ask for anything in return.
Makes your job easier and makes people like me's life better.
Yeah, it sure does.
Basically.
And that's the way we should all be. But we've got someone here who actually lives here, who has breathed this, who has helped to make it happen. She is the nurse manager here at the NICU. See, I learned how to say NICU. Pam Sanders.
Right now.
It's nice to see you, Pam. Thanks for joining us.
Thank you for having me.
Tell us a little bit about what we have here. Tell us what this is all about.
Well, like Pam told you, years ago we set a vision, our mission and our guiding principle, we called it, was to create a warm, healing, soothing environment for the patient, the family, and the staff. And then as we made design decisions across the way, we would say, does that meet our mission or does it not? And because she explained we came from the cave, Jack, you talked about being in the area with all the alarms, and I always refer to it as being the sickest you've ever been and being put down in the middle of an arcade is what it would be similar
and
to.
And it really was, and I'm a hillbilly out of West Virginia, but even for me, you would look at that and think, this can't be the best healing environment, or
it was the best of the best when it was built many years ago, and it just needed to be redone. And so luckily the Mumas blessed us with being their benefactors and chose the NICU as their focus, and so we really embarked on a journey to create a wonderful new NICU. We have a little over 54,000 square feet. We have 80 single family rooms plus a 2-bed procedure room, which we are standing in, but and it is truly a nice place for the family to come and visit with their baby, and a lot of our families stay a long time, and so it provides them that ability to bond in not a home environment, but at least a healing environment.
That's so critical, and Pam talked about that too, that they are able to come here, unlike the previous facility, and it's so important for the parents to be there, and it does so much for them, and obviously they're going to be looking over their kids.
Well, you've got some incredibly talented staff members here. I mean, tell me some of the amazing success stories. I mean, some of these babies come out smaller than the palm of my hand.
They do. Technology has advanced to the point that you the cusp of viability now is around 23, 24 weeks. So those babies are literally a handful. They will literally fit in the palm of your hand, and they are figuratively a very busy handful because they're very critically ill. But they weigh around a pound.
Wow.
So that's the smallest baby. That's the smallest baby you'll probably see.
So we're looking at a baby that's probably this big?
Just about, yeah. They're very tiny, but they need help breathing. They need help because they can't take a bottle. So you provide all of that for them.
And these people are so special to deal with those. I mean, you know, typically medical professionals deal with people like you, myself, or little kids or whatever.
Yeah, but we need a bottle sometimes too.
Well, that's true. But I remember going in there and seeing, and that was my first time ever in a neonatal unit like that, and seeing what you're talking about, those tiny little figures there, and how incredibly specialized these people are that deal with them, because I guess they learn it maybe in medical school somewhere, but I've never seen an environment like that in my life.
We have a phenomenal nursing and medical team here that work very well together to provide for not only the needs of the baby, but the family as well. So we're very blessed in all that we do.
So who would be here? You have neonatologists?
Neonatologists.
Nurse practitioners?
We have nurse practitioners, we have nurses, we have respiratory therapists, we have physical therapy, radiology, and any service that you might, adult might need, a baby might need. Ultrasound, all those things go on in the NICU.
And so tell us about some of the challenges that these premature babies face. I mean, they're born, they're 15 weeks too early. Tell me what happens then.
Well, they're very early, so they have to grow. They have to learn how to eat. They have to maintain their temperature. The risk of infection is very great because your skin is your largest organ and it is your first barrier against infection. And their skin is very immature and very fragile, so we work very hard to protect that by providing humidity. You've seen our incubators. Our incubators allow us to provide a micro environment for our babies because each one might need something different. This baby might need a temperature that's 92 to keep his desired body temperature, and the next baby in the next room might need 98. And you can't work in that environment, so the environment of the NICU is 74 to 78, but a baby that small is not going to be able to keep their temperature in that environment. So you have to provide all those things for them. Also, they don't eat, but they still need to grow, so you have to give them nutrition in a different form for your IVs and things. But we also need to get their gut going, so we start giving them breast milk, fairly early, preferably breast milk if the parents are able to provide that, in which we strongly encourage. But so we have to provide all that for them to get them ready, so when they can be on feeds, that they're ready to go.
And then they get to the point where, I mean, I know it's neonatal. At what point do most of them get released, and what happens then?
Well, we send our babies home with our families.
They go home with their families.
They go home with their families,
Yeah.
and they may take them several months to get there, but they have to eat, they have to grow, and be able to maintain their temperature, and before they can go.
So basically, they're put on their own. I mean, the kids are on their own system, so to speak, not on
Yes.
their own, obviously.
Yes, well, it's a transition. They may start out in the incubator with humidity, and then they'll go to an incubator without humidity, and then they'll go to a crib, and then when they get in the crib, they have to be able to take their bottle. They have to be able to take their bottle in like 30 minutes, the time frame, because it burns calories to eat. So they need to be doing it in a timely manner so they're not burning more calories than they're taking in with their formula.
And all the while, the parents or family members are able to be here with them, because I know that is a traumatic circumstance. If a baby's here for 4 months, I mean, that's very disruptive to a family's life. So you have facilities here for them to be close to it?
It is very disruptive to the family's life. And we have the single-family room allows the family to be able to come in with their other siblings. In the old unit, you couldn't bring siblings in because they were exposed to every baby. Well, now they can come in and visit just their baby. And so it affords them that. The family also we have a wonderful family learning center that has a place for the family to go out and have a meal, take a shower, do some laundry if they're going to stay several days. There's just a variety of resources here that encourage the family to visit, because they're the primary care provider. They're who's taking the baby home, and we really want to get them integrated into the plan of care and the things that the baby needs.
Pam, you're an angel.
I doubt that, but thank you.
We are at the Jennifer Lee Mumma Neonatal Intensive Care Unit. We'll be right back.
Howdy, Tampa Bay. I'm Jack Harris, combing through the archives of Tampa Bay's Moments in Time. Tonight, we expound medically with a quick history of a neighbor who's always there in the clutch, Tampa General Hospital. Our story starts in the roaring 20s as Tampa's population soars over 100,000, mandating the want for a big city hospital. At the time, locals in need of urgent care had limited options, with the only nearby hospital housing just 32 beds. Legend has it that D.P. Davis, the developer of Davis Islands, devised the idea to place a hospital on his emerging island neighborhood while golfing with civic leaders. In a sand trap, Davis drew the shape of his island and said, "Where do we put the hospital?" The island's north point was chosen by longtime community medical leader J. Brown Ferrier. Construction began in 1926, and on November 6, 1927, the doors to Tampa Municipal Hospital opened. The building, however, was not completed until 1935 because of economic struggles with the Great Depression. In 1956, its name was changed to Tampa General. In 1970, a union with USF's medical school solidified TGH's status as a teaching hospital. In 1985, the facility was the site of Florida's first heart transplant, and it's now one of the nation's busiest solid organ transplant centers. Patients once rushed to the hospital by horse-drawn ambulances now arrive in state-of-the-art AeroMed helicopters that service 23 surrounding counties. What began as a one-building, 186-bed hospital has grown into a world-class medical facility with over 1,000 licensed beds and nearly 7,000 employees. Through years of fundraising, the Lightning and Lightning Foundation have proudly contributed to TGH's Child Life Room and the Neonatal Intensive Care Unit. Here's to you, Tampa General Hospital. Learn more about our region's great stories at the Tampa Bay History Center, located just east of the St. Pete Times Forum.
Welcome back for another segment of the Mayor's Hour. I'm going to do something now that hasn't been done since the last time Mayor Greco was here.
Oh my goodness, what are we doing? That's the 10th show in which you've kissed a guest. No, I was kidding.
But Jack, in this case, I get to kiss my wife. For those of you who haven't met your First Lady, this is Dr. Kathy Lynch Buckhorn, more affectionately referred to around here as Dr. Lynch. And when I am here, I am merely Mr. Dr. Lynch.
Mr. Dr. Not even Mayor Dr. Lynch.
Not even Mayor Dr. Lynch. It's just Mr. Dr. Lynch. We're here in OR4, which is one of the obstetrics and gynecology operating rooms. My wife, obviously, is a practicing physician. She is an OB-GYN and also Vice President for our Women's Health at USF. So, sweetheart, it's good to see you.
It's good to see you, honey.
Yep. Jack, this is pretty cool.
Strange sitting here calling a guest sweetheart. We've never done that on the radio or anything.
We are dressed up because we are in the operating room. We don't normally dress like this, but I feel like Mike Dukakis in a tank. But it's okay. It is okay.
The Mike Dukakis look, we've got it today for sure.
But Jack, we're seeing some really cool things here at the hospital.
Oh, we certainly are. And I wasn't really familiar with the women's portion of this thing at all, having been here many, many times as a patient with family members who are patients and everything. But I guess this is a pretty significant part of Tampa General Hospital, given that all that happens here.
Absolutely. The Women's Pavilion in the Bayshore Pavilion opened in 2007, and it's a beautiful facility, as you can see by this operating room that we have here. This is one of 4 obstetric ORs, and we also do in vitro fertilization.
You've got 4 obstetric ORs?
4 obstetric ORs and 4 separate gynecologic ORs, and 23 labor and delivery rooms.
Wow. So, well, you can be popping out babies like crazy
here. We try to keep them under control as they pop out. So,
so I finally get to ask my wife, what do you really do here? Tell me what goes on here at this.
Well, here we do cesarean sections, and we deliver the babies that need to come out more expeditiously, or else they've had prior cesareans, or the babies aren't coming the right way, and we need to go on ahead and go into the abdomen and get the baby out. Sometimes we also do normal deliveries in here, usually of twins that we need to be present in the operating room just in case the second baby decides it wants to come in a different direction. Last year, we did 1,612 cesarean sections at the
that many cesarean sections alone,
which is pretty good considering our overall deliveries were 5,700. So we have one of the lowest cesarean section rates in the area.
About 1 in 5, roughly.
Yeah, yep.
And that's a pretty good number, I guess.
That's an excellent number. Yep.
Well, I know U.S. News and World Report has listed Tampa General Hospital as one, and particularly the OB department as one of the best in the country. I mean, tell us what else goes on here. Tell us what the other docs are doing.
Well, also in this room, as I mentioned, is in vitro fertilization, IVF. So for those families that can't quite manage to have babies in a natural manner, this is where they get the eggs, and there's actually a little pass-through over in the wall there to the IVF lab. It is such a secured environment. The air is so controlled in there that I've never even been in there. Only the embryologist goes in there. And then after they do the insemination and the embryos are created, when they get to day 3 or day 4 or day 5, then they're put back inside the uterus to hopefully grow like a normal pregnancy. Over on the gynecologic side, we do hysterectomies and your favorite stuff, the pelvic reconstructive surgery.
Oh, yeah. I had to do a proclamation once for Pelvic Reconstructive Surgery Day.
Well, you're kidding. I didn't know there was a day, and I missed celebrating.
I had to stay 6 feet away from that proclamation. It was making me really nervous. The things that mayors have to do, the days I have to proclaim, Pelvic Reconstruction Days.
So we also have all the ORs over there are equipped for laparoscopic procedures and laparoscopic hysterectomies and laparoscopic vault suspensions. He loves it when I start talking like that. And also the robot is over on the GYN side for robotic surgery.
What? The robotic surgery?
Robotic surgery, yes.
What is that all about?
Well, there's a number of different things that the robot can be utilized for. Complicated hysterectomies, certainly in the oncologic. For cancer patients, it allows you to do the surgery, getting the lymph nodes, without having to make a very big incision. So the robot actually gives you 3-dimension.
So that goes in instead of the physician's hands.
Yeah.
You use the robot. I wasn't aware of that.
Yeah, and you look in the monitor screen as if you're playing a little video game.
That's amazing.
I've tried that. And I cut the dickens out of whoever that was. There was blood everywhere.
Fortunately, it was a simulator. And in fact, we have the new simulation center, the Center for Advanced Medical Learning downtown. And so I wanted to give Bob his own USF cap that he can wear down there and his own personal scrubs.
Oh, he gets
so that
scrubs.
So he can try again to go
and
to
his
the
name is on it, Mayor Bob Buckhorn.
Mr. Dr. Lynch.
Mr. Dr. Mayor Dr.
So he can
Lynch.
try again, because I'm told by the dean that it really was a bloody mess when he was on the robotic simulator.
The only time people talk about, the only time you hear a lot about the OBGYN is first baby of the year, when it was born, how close it was to the new year and that kind of thing, or when there are multiple births. Do you often have those multiple births? More than 2, say?
Yes, we probably have triplets about 6 to 10 times a year here. I know there was a recent set of triplets that were on the Labor and Delivery Board. They were a little preterm. I'm not sure what happened there. But we get a lot of the high-risk triplet pregnancies referred here. I believe there's a couple of twin pregnancies currently sitting out there. The twins seem to be, depending upon how the IVF guys are doing, the multiples increase. So, but we get a lot of triplets. We haven't seen a quad pregnancy here in a couple of years, but
you have had them.
Have had them.
Now this is also a teaching hospital as well. So you have residents here, you have interns.
Medical students, residents, and the important thing to keep in mind is that the resident physicians have completed their medical school and they're doing advanced training specifically in their area of expertise. So when I completed medical school, I then had to do 4 years of an obstetrics and gynecology residency to then be able to be boarded in obstetrics and gynecology. So we teach all the medical students the basics of care of women in obstetrics and gynecology, both in the inpatient and outpatient setting. And then more specifically, we teach the residents how to be a outstanding obstetrician gynecologist. So you have several people looking over you when you're getting cared for to make sure that you're getting the right care and that it's the most up-to-date, most current, and the best thing for you.
Well, Dr. Lynch, sweetie pie. I will actually be home for dinner tonight, but we've got to end this segment. We're coming back with the Vice President of Surgical Services, John Bond. Looking forward to chatting with him as well. And this is a great facility, folks. It is a great relationship between USF, Tampa General Hospital, world-class treatment, world-class talent. So to my First Lady and the First Lady of the City of Tampa, wait a minute.
I was wondering if he's going to do that again. I can't wait to see you with John Bond.
We'll be right back.
I might be afraid to come on here now. I don't know what's going to happen.
We're here at Tampa General Hospital. We've seen some really amazing stuff and met some incredible people, including my wife. She made me say that.
That's a treat to get to work with your wife for a change.
I know it is. You know, given our schedules, we don't see each other a lot.
I can imagine that.
Sometimes it's like two ships passing in the night, but she's an incredible physician, and she's lucky she married me.
Oh, brother! Can we
wait till I get home tonight,
Can
Jack.
we scrub that?
Jack, that's the only time I get to say that. I never get to say that at home. Jack, tell us who's here. Tell us about John Bond.
I want you to meet John Bond, and I promise you I'm not going to kiss him as we did our last guest for sure, and I'm sure he's very happy about that. But he is in charge of the surgical services, not the cervical services.
Probably,
I think we're into another area.
That was the last
there. That was where we were last time. But as Vice President of the surgical services, what does that mean? What does that entail? Because you're not actually a physician, right?
No, I'm not.
But
I'm a nurse by basic training, and I'm entrusted with the oversight of the daily operations of 41 operating rooms.
41
operating rooms. I have all of the operating rooms except these 4 here in the OB suite. So we do a little bit of everything that you can imagine in a major teaching facility, from basically solid organ transplants to OBGYN, to parathyroid surgery, to major orthopedics, neurosurgery, cardiovascular surgery, ophthalmology, otolaryngology, oral and dental general surgery, GU.
Really? Oral and dental surgery even in here?
Yes, sir.
That's surprising.
Yes, sir.
About how many, when you say 40, I'm just wondering about how many are in use at any given time, or how many times do you have an operation taking place per day in each one of these suites?
Monday through Friday, we run about 110 cases a day through the operating rooms.
Wow.
We're a 24-hour, 7-day-a-week operation. We're a major trauma center, as you know, in conjunction with USF, so that's open 24 hours a day. We have one dedicated room that is set up in the main operating room on the 2nd floor that is solely just for trauma. And it's immediately located very close to the trauma bays of the new emergency department. And it provides, I think, the best care that anybody could provide around here. We're very close, very proximate, full line of service for just about anything anybody could need.
Well, John, Tampa General has been recognized as one of the finest medical facilities in the country. I mean, there are certain specialties here that are world-renowned, certainly the U.S. News and World Report, Jack.
Transplants, I know you've been pioneers here in transplants over the years. Tell us a little bit about the transplant operations that go on here.
We have a solid organ transplant program that ranks in the top 10 in the country.
Yeah.
I think we're number 4 or number 5 in heart transplants at this point in time. We did 55, 56 heart transplants this past year.
Kidding. Wow.
We've done 57, 58 lung transplants during the past year. Well over 200 kidney transplants, over 100 liver transplants, a few pancreas transplants. It's a very busy program. We receive referrals from all over the southeastern United States, even as far south as Puerto Rico, Texas, up into the Kentucky and Tennessee region, as far as potential donors coming from those areas.
And I guess the problem there is getting the organs, not so much getting the facilities, getting the people who can do it. You have to await the organs and that kind of thing.
That's correct. We have a team here that goes out with our transplant surgeons, especially for heart and lungs, that go on and to retrieve the organs and bring them back. As you can imagine, it's coordinated with a lot of effort through LifeLink, which is our organ procurement organization. And it's a very orchestrated effort with hearts and lungs. We've got a very short time to get the organ here and get it transplanted into the patient. So everything has to work like a well-oiled machine.
Well, you've had a major expansion here in the last 3 years.
Yes.
And I know you had a new NICU. Obviously, we saw that a little bit earlier. You had this wing. What else was there that was added?
Well, this wing in itself was, I think, about a 340,000 square foot addition, which is the emergency department on the second floor, the cardiovascular center on the third floor, the women's center here on the fourth floor. The fifth floor is intensive care units, and the sixth floor is the digestive disorders program, in which we have a gastroenterology center, which has 8 procedure rooms in there, and basically do procedures that are not done by most places. We do a tremendous amount of ERCPs, which we have one of the USF physicians, Dr. Patrick Brady, is a very highly respected specialist in that area. And
a new ER?
Say again?
Was the ER new also?
ER was brand new, yes, sir.
Yeah, this is an amazing place, and people don't realize that we have all of this probably on a smaller footprint than any like facility in America, because everything is kind of squeezed in here on the edge of Davis Island.
On the tip of the island.
And you talk about building new things and expanding in so many 100,000 square feet. Most people out there don't even know that's going on.
Correct.
Well, you really appreciate it. I've been here, unfortunately, a lot, and I've seen the care that they've given to our police officers and firefighters when they've been injured in the line of duty. And I mean, it is. We are so lucky to have this facility in close proximity to virtually everybody in the Bay Area.
Yep.
I mean, it's a level 1 trauma center.
Correct.
I mean, if you ever get hurt, I mean, this is the place that you want to be, because you're going to get world-class treatment and cutting-edge technique, and it's just, we are so lucky to have all of you here, and so thankful for what you do.
Thank you very much for the kind words, and we feel very honored to be here and be part of this community and to be able to contribute what we do.
Good. Well, thanks, John. We're going to go to a video right now, and then we've got some exciting stuff coming up. Jack and I will get out of these outfits.
Oh, thank goodness. There are no pockets in
them. Yeah, I know. And we'll see you in a little bit.
You gotta eat.
Enjoying an afternoon snack is a major milestone for Anna Robinson.
This is huge. This is actually a special bottle we have to use that helps me to squeeze milk into her mouth.
But Anna was amazing her mother even before she was born.
What a miracle baby she is.
Halfway through the pregnancy, doctors spotted large fluid-filled tumors wrapped around the baby's neck.
The mass is both in her neck and some in her chest.
She wouldn't be able to breathe outside of the womb.
Into the delivery, we were prepared for the worst. I mean, my husband and I knew when we showed up that day that that might be the last day that she was alive. So we knew that, as we said goodbye, I would, go to sleep and maybe not see her alive.
A team of 20 doctors at Tampa General Hospital packed an OR to do an exit procedure. It's a C-section where they only deliver the baby's head, one shoulder, and one hand.
So the baby's still remaining on the support of the umbilical cord and placenta while part of the baby is still out.
While the baby's still receiving oxygen from the mother, the team has a 90-minute window to put a tube down the baby's throat and open up an airway.
This circumstance, it took us 7 minutes to secure the airway and then proceed with the rest of the delivery.
Other surgeries followed to remove the rest of Anna's tumor. Doctors say her future looks bright.
She is just beautiful, just adorable, sweetest baby you've ever met.
A baby who beat the odds before she took her first breath. I'm Melissa Medley reporting.
Welcome back to the Mayor's Hour, Jack. We are out here on the landing strip for the Aeromed helicopters. These are the guys that get out there in serious traumas and show up like angels coming down from the sky to render world-class health care to people in very, very traumatic situations. And we see them buzzing around all the time. I would bet most people don't really realize how skilled the flight medics are, and what a great facility this is and how important this is to our area.
Yeah, not just moving these people to the hospital, but at the same time beginning the process of trying to take care of them.
Yep, these are equipped like rescue vehicles. They're staffed by flight medics who are paramedics, some of whom work for Tampa Fire Rescue. We have one of the flight medics with us, Josh Keffler, today. Josh, tell us a little bit about what you do every day. It must be an amazing experience.
It's a great job, being able to help out in the community, go out there, pick up patients that are in dire need of getting to doctors, and be able to speedily and safely transporting them back and provide them with a higher level of care en route back to the hospital.
We see these things coming in and out all the time, as the mayor says, those of us who live nearby. About how often are you called upon to go out? Because obviously it's not something you say, we'll do 5 flights tomorrow. You got to wait and see what happens.
We have 5 aircrafts in the program, and we average about 200 flights a month between the 5 aircrafts.
And you go out in some pretty rough conditions too.
Well, weather is barring a factor. We will go out in rain, but if there's thunderstorms and lightning, call it a day. It's the safety factor.
And what triggers, whether it's a transport by a rescue vehicle or a transport by an aeromed?
Time, traditionally, a 30-minute time limit. If a rescue vehicle decides that it's going to be 30 minutes to get them to a level 1 trauma center or a level 2 trauma center, they'll call us. That could be traffic impedances or just geographic area.
And is it largely driven by the severity of the wound? Obviously, if they're coming to a level 1 trauma, they're in bad shape.
Yes, sir. The trauma alerts are what they're called by the state, and it's governed by Florida State. And if they call a trauma alert, they need to come to a level 2 or level 1 trauma center.
And when you talk about different places, do you take them places other than TGH?
Yes, sir. We take them to the closest appropriate facility. So being whatever their injuries are for that, whatever facility is closest, we will take them to.
What's the farthest you have gone to pick up a patient that you know of?
Program-wide, they'll cover the whole state. As far as trauma alerts and scene calls, we cover about 23 counties with our 5 aircrafts. But inter-facilities coming back to the hospital or that other hospitals need transported to, Jacksonville, Tallahassee, our Aeromed 5 has been as far as Key West.
And we have seen, of course, in movies and things like that, you see what happens, as you say, on the vehicles, the ground vehicles, when they're brought in there and they start treatment on them right away. And I guess basically this thing is like one of those things up in the air, isn't it?
Yes, sir. It's a mini ER critical care room, just all compact into a small package.
And so you're doing IV, you're doing, compression of wounds? I mean, you're doing everything that we see in the emergency room. You're just doing it going 150 miles an hour at 3,000 or 4,000 feet in the air.
Yes, sir.
Bouncing around.
Yes, sir.
Hard to stick an IV. Do you ever miss with the IV?
They're pretty smooth from what, talking to my colleagues out on the street. Actually, the ambulance can be a little bumpier sometimes, but depending on wind turbulence, it'll be a little bumpy.
What's the most unusual experience you've had in going out on one of these things?
My most unusual experience is just sitting on scene of a call where we're waiting for fire departments to actually extricate the patient and getting them to. We've had crew members landing at the shipyards and docks and going into the bowels of ships with the rescue crews. We've had flight members that have came back with the Coast Guard because the Coast Guard helicopter was the only thing that could fly at that time.
Because of the weather and
Because
everything.
of the weather, yes, sir.
So you will go out, let's just say you're at a car accident. I mean, you will go out and will you wait for the firefighters to extract the victim before you go in there? Or do you end up sometimes going in to treat them as they're trapped in there?
Well, yes and no. If the vehicle's stabilized and the fire department has wanted an extra set of hands or a little bit higher level of care, they will ask us to come provide patient assistance while they're still extricating the patient. But in that aspect, we're not trained for that.
Right.
They're the ones trained for that. So we do have to watch our P's and Q's and find them.
You're a nurse by trade.
Yes, sir.
That's amazing.
And basically, you're like the people that are at the fire department or wherever, because you just sit around here, except for other than with a truck, you're sitting around here with a helicopter waiting to go out.
We're a little bit higher level of care. Our protocols through our medical director, Dr. Karuba, has allowed us to do a little bit more in-depth skills and procedures. So we're a little bit higher level of care in that aspect, where we can take more stuff, more medication drips, more drugs, and a lot more procedures.
And are all of you nurses or paramedics?
The nurses have to carry a dual license as a paramedic, and the medics are strictly paramedics. Yes.
And who are your pilots?
Mostly all Army and Navy and Air Force.
I was going to say, I guess they're all military vets.
There's a requirement. Our vendor is Air Methods. They provide us with a few of the helicopters and the pilots that fly them. But most all of them are all ex-military pilots.
And you say vendors, so these aren't owned with the hospital or anything like that?
The one you're looking at behind you is.
Oh, it is?
That one is owned by the hospital. The other 4 are lease agreements type deal with the vendor Air Methods.
And they provide the military guys. I've ridden with the military guys before, but fortunately never in a trauma one.
Well, Jack's a Vietnam vet and spent a lot of time in helicopters, and they were shooting at him. Hopefully they're not shooting at you.
No, but I would feel comfortable because all our pilots are pretty well trained now. The helicopter's probably a little more maneuverable than this one, but they're all, like our pilot today, John is ex-military, he's Army, so.
What's amazing, I've been out here to watch them land, and those guys can put these helicopters down on a dime.
Oh, they can.
I mean, they come in here, it doesn't matter what the wind is doing, and they'll come in and hover, and they'll land it right there on the H, or right there in the middle of the Tampa General logo. It's pretty spectacular.
It certainly is that. Well, we sure appreciate your...
No problem. Appreciate you guys coming down and talking to us.
Well, we'll be right back. Josh, thank you for what you do. I mean, I don't know how many lives you've saved, and you and your colleagues, and I know they're appreciative, and we are as well. But stay with us. We'll be right back. We don't look nearly as good as he does in that flight suit, but we'll do the best we can. See you in a minute.
Yeah, they had us dress in the other thing. Why didn't they dress us in flight suits?
Yeah. We got a couple in the back.
Yeah. The night of the accident, I'll never forget. My wife and I were actually lying in bed. We were reading magazines, getting ready to go to sleep. We got a phone call. It was a truck driver. He had seen an accident ahead of him and stopped. My daughter gave the number to him, so he called us and said, "You better come quick." When we got to the hospital a little bit later on, found out that she was paralyzed, and we all cried real hard.
Thomas Doyle's daughter, 26-year-old Molly Santiago, the mother of 2 young children, was in a horrific car accident and suffered a spinal cord injury.
At that time, the only thing that Molly could do was blink her eyes. She couldn't turn her head. She couldn't really speak much more than just a soft whisper.
But Thomas had no idea just how serious her injuries really were and expected a rapid and full recovery. Molly spent 8 weeks in the hospital recovering from multiple broken bones and other injuries. Then doctors decided it was time to focus on the damage caused by the spinal cord injury. They suggested sending her to a rehab facility.
I remember turning to my wife and saying, "Why is she going to rehab? She can't move. She can't do anything."
Molly was transferred to Tampa General Hospital's Rehabilitation Center.
And before long, Molly started moving a little bit.
Then moving a little bit turned into moving a lot.
Where I could shrug my shoulders. I was able to lift my arm. And now, a year later, I am able to move one leg, 1 foot. I can wiggle all of the toes. On 1 foot, I have almost full dexterity of both of my arms. I'm able to feed myself, partially dress myself, a lot of daily functions.
They were working very hard with her in the rehab center. The girls were very great with her. They did things that just made me kind of cringe when they made her move her broken arms and stuff like this, but they had to do it at the time.
But for Molly, it was all part of a necessary plan to get her home and back to being a mom. She knew therapy was the key.
Oh, I absolutely loved it. I had my occupational therapist was Stephanie. She was absolutely wonderful. My physical therapist, Emily, both have just such knowledge of what they're doing and such a heart for what they're doing.
Tampa General's Resource Center staff helped Molly's parents prepare to bring their daughter home.
You know, widening doors, taking up carpet, putting smooth flooring down. The rehab specialist would go, "No, Dad, this is not the way to do it. You know, this is the proper way to pick her up, and so you won't hurt her, etc." Well, I fought that for a little while, but then came to understand the wisdom of what they were saying. I'm convinced that the advice that they gave us, what we did at home, plus their expertise on knowing what to do and when to do it, plus pushing Molly so hard to improve, it really came to play in her great improvement. You know, I shudder to think what it would have been had we not had the excellent care at a rehab center like Tampa General.
Today, Molly is an active mom who still loves sports and looks forward to the future.
I was and still am determined to make a full recovery. However, my therapy and rehabilitation has given me a whole new outlook on how I can continue to live my life as normal as possible.
Jack, well, this is another great show. I mean, every time I come out to Tampa General Hospital, I'm just amazed at the level of care, the level of expertise, the enthusiasm for what these folks get up and do every day. I mean, this is a facility that everyone in the Bay Area should be proud of.
Oh, it is. It's one of the best in the country, as we said again and again. In so many areas, they're in the top 10 in the country. And what's really remarkable is how it's turned around so dramatically in the past 20 years, 15 years, because we can remember when they were having to do everything to try to keep Tampa General Hospital alive. And all of a sudden, it's thriving. It's doing such a great job. And you got to credit Ron Hightoff and all the people that he's brought in to do that.
Yeah, I think Ron Hightoff has done an amazing job. And you look at families like the Moomas who have helped to finance a lot of this.
Yes.
I mean, it's been a turnaround that's worthy of a chapter in a book.
Oh, you better believe it. Speaking of books, this picture will certainly go in mine if I ever write one. See if you remember this day when you were working.
I do. It was at the fairgrounds, wasn't it?
No, this is at the old Pulse Plus studios down at Channel 13 in the old building. They've got a picture. Everybody can take a look at that now.
That's when I had hair and it was brown, and Jack had.
I had a lot more hair.
And his was brown too. That was great. I think it was Jack Harris Day or something.
Well, it was my last day on Pulse Plus.
My gosh.
You came down and you were working with Mayor Sandy Friedman in those days.
Those were fun days.
Oh, they were.
Look how far we've come.
You're mayor and I'm not in TV. Hey, I want to bring up a couple of things that are going on around here. The lighting of the bridges. What a spectacular thing that's going to be.
Well, Jack, thanks. And you know, as you can see from this picture right here, and just multiply that by 4. To light up those iconic structures, not just for the RNC, but for us, all year round.
The fact that it's going to stay that way.
You know, and TICO really stepped up to the plate. I mean, they're the ones that put the money up for this. It was north of $300,000 to light that up. It's going to be the neons, and we've seen some of the renderings. They are spectacular. People are going to be amazed how dramatic that is.
Oh, that will be. And I'm working with some people in Ybor City now, General David Scott and a bunch of others. We're trying to look to doing something like what they do in St. Augustine during the Christmas holidays, and that's light up all of Ybor City because they say it's tens of millions of dollars as an economic engine over there, they say, during the Christmas holidays. And, you know, we don't expect to do the same thing here, but it can be really spectacular. A couple of other things I want to bring up. One that I really love, and that is what you're pushing for the courthouse downtown. That is going to be awesome to have a boutique hotel down there.
Yeah, well, the first day I got to the mayor's office, I said that's a building that we've got to get back on the tax roll.
It's so beautiful.
Oh, it's gorgeous.
Spectacular.
Yeah. It is probably the nicest structure that we have in downtown Tampa.
Yep.
It's been boarded up for 10 years. We worked hard to find a developer that could make that project work and make the numbers work. We found a guy who has done historic hotels around the country. It's a $22 million investment. They're not asking the taxpayers for anything. They're looking at 100 rooms, hopefully opening within 18 months. That building will go back on the tax roll, potentially as a 4-star boutique hotel.
Oh, yeah.
I mean, it's a win-win for everybody.
Yeah, and that great federal architecture. Yeah. I mean, you know, it looks like one of the buildings out of Washington, D.C.
It does. It's a big, muscular, Gothic building, and all marble floors, you know, high ceilings. I mean, it is really dramatic.
And the things happening on the Riverwalk, and you know, the growth of the Riverwalk, and I know in talking with some people, working with some people on that too, and historic markers for there, and things that people can even stop and look at as they go along. And I'm pushing for a Walk of Fame like they have it out in West End of St. Louis, where famous people who have either moved here or who have been born here, have gone into movies, or the George Steinbrenners, the Derek Brooks, once he gets into the Hall of Fame, Leroy Sullivan, people like that, that'll be, you know, something else that'll add to the dimensions of the Riverwalk.
Sure. But I mean, we've got to give people a well-rounded experience when they come there. It can't just be walking on the river. We need the bars. We need the restaurants. We need the amenities.
Yes.
We need the boat slips. We need the cultural attractions, the public art to make it exciting. So yeah, there is so much happening downtown, Jack. I mean, I wake up every day. I cannot wait to get to work.
One other thing I got to mention you've done too, and that is everybody's talking about jobs, jobs, jobs. You've done something that will facilitate the work of businesses and growth here, and that is the streamlining of the licensing. That's going to be huge, I think, in the long run.
Yeah, we've got to get people through that permitting process and get them out the door, building buildings, creating jobs, creating opportunities. I mean, it's an exciting time in the city of Tampa, Jack. This has been a great show. This hospital is a big economic engine for us as a community, and we're excited about what's taking place out here. And Jack, I appreciate you asking about some of the other things that are going on. Stay with us. We'll be back next month. There's a lot happening this month. Stay tuned. Good things are happening.